Good evening, students, and welcome back for the Viva on the pubic bone. This is the pubic bone which lies antero-inferior to the acetabular fossa. Okay. Now this is a flattened bone. Okay. Now the first question which may come for this pubic bone is that show me the parts of this bone, pubic bone. Then you can say that this is the body of the which is flattened. Okay, it is the body of the pubic bone, and from superior aspect of the body going upward and laterally is this ramus, that is called as the superior ramus of the pubic bone, while antero-inferiorly, okay, I would say this postero-inferiorly going and another ramus is here coming out from the body, and this is called as the inferior ramus of the pubis. So you can show in this way body, superior ramus are the parts of the pubic bone. Then he may ask, show me the surfaces of the body. You can show the surfaces of body just by putting into the anatomical position roughly. You can show that this posterior smooth surface is the posterior surface, okay, while antero-inferiorly surface it is here, it is the rough surface. This is the anterior surface lying just below that of the pubic crest and the pubic tubercle. This is the anterior surface of the body, and this is the pelvic or the posterior surface of the body. Then the third surface of this body is this, and this is the symphysial surface, which will form a symphysial pubic symphysis or symphysial joint with the pubic bone of the opposite side, okay, the pubic bone, right. So these are the three surfaces, okay, anterior, posterior and symphysial surfaces are there. So that he may ask, where is the pubic tubercle? You can show on the anterior aspect of the body of the pubis, just at the upper border, this bony bump, okay, or this projection here is the pubic tubercle, and then the rough area going towards the pubic symphysis near the upper border, this is called as the pubic crest, okay. So this is rough area, rough ridge going, so this is pubic crest and this is the pubic tubercle. He may ask, what is the attachment onto the pubic crest, pubic tubercle? You can say that it is the medial end of the inguinal ligament, okay, the medial end of the inguinal ligament. Then the Viva may shift to the superior ramus of the pubis. Now this superior ramus of the pubis is triangular in the cross section. So he may ask, what are the borders of the superior ramus of the pubis? Okay, you can show that one which is tracing, when you trace it from the pubic tubercle going to the acetabular notch. See this acetabular notch? This is the anterior border, okay, or obturator crest. This is also called as the anterior border or the obturator because it is close to the obturator foramina. Hence it is called obturator crest. Then there is a posterior border coming from pubic crest going towards the iliopubic eminence, which is the junction between the pubic bone and the ilium bone. So this is up to the iliopubic, and this is a sharp border, the posterior border, and this is also called as pecten pubis. This sharp posterior border is called as pecten pubis. Then there is a border which is also called as the inferior border. This is the inferior, which is forming the margin of the obturator foramina below, okay. So these are the three borders. Then comes through the surface. He may ask, show me the pectinial surface, okay. Then the pectinial surface lies between the anterior or obturator border and this sharp pecten pubis. This is the pectinial surface. He may ask immediately, what is the attachment onto the pectinial surface? You should reply that this surface gives attachment to that of the pectineus muscle, origin of this surface, pectin surface to the pectinial. Then this is the symphysial surface is here. I mean to say this is the pelvic surface of the superior ramus is there, okay. So these are the borders and important surfaces Okay, then he may ask you, show me the other ramus arising from the body of the pubis, and this is that inferior ramus of the body of the pubis. Then he may ask a question, what is the conjoined ischiopubic ramus? You can see that say that the inferior ramus of pubis and the ramus of ischium, both they meet each other and form a conjoined ischiopubic ramus. So this is a conjoined ischiopubic, that is the junction is there for the with the inferior ramus and the ischial ramus. Okay, and they form the conjoined ischiopubic ramus. So this is conjoined ischiopubic ramus will have the two surfaces, an outer surface and an inner pelvic surface. It will have the two surfaces, right? And you may call it as anterior surface and the posterior surface also. Then he may ask some of the attachment of the muscles. Okay, ligament and pectineus muscle I have told you already here. Then the muscles which may arise, usually asked is just mark the attachment of the adductor longus. So just below to the adductor tubercle, okay, from the anterior surface of the pubic bone, you may mark this rounded origin of the adductor longus muscle. Okay, this is quite a rounded origin of the adductor longus. And then there may be a question to show the origin of the gracilis. Okay, it is the gracilis. And the gracilis takes origin around from the inferior ramus of the pubis near the border. Okay, so this is the margin, at the margin. This is the gracilis muscle, origin of the gracilis, and just behind that there is a elongated origin here from the middle part of the outer surface of the conjoined ischiopubic ramus. This is adductor longus. Okay, and gracilis, adductor longus, and then the adductor brevis here, and then the pectinius here. These are the three important muscles which takes origin from the pubic bone. Okay, from that of the pubic bone. I think this is enough for the, I mean to say, pubic bone. It is, of course, for the pubic symphysis there may be a question that why it is called a symphysial surface. You can say that here is the attachment of the symphysial ligament, pubic symphysis, that which is a fibrocartilaginous disc. Okay, and this symphysial surface will show the various bony features with the increasing age or with the changing age. Ridges and grooves are seen on this surface. Of course, very faint ridges and grooves are seen here in this bone. Okay, and when the old age will come, they will disappear. Okay, this ridges and groove. Thank you very much for watching this short video on the Viva on the pubic bone. The last video on the pubic bone I will tell will be for the ischium, Thank you for watching this.